smoking a joint, weed, pot, marijuana, whatever you call it. Most everyone has smoked or even eaten some of those special brownies. People have used this plant for years to relax and forget about their worries. I know everyone in this room has either experienced it firsthand, known somebody who uses it, or dealt with patients who use it. I honestly have never tried it. I didn't even smell it until I was 30 years old at a 38 Special concert in Skullbone, Tennessee. But with the new onset of legalization of marijuana and CBD, I feel it's very important for us to be informed on the fetal development and growth of the brain. To give a little background, marijuana is a flowering plant from the hemp family, and it's native to Asia. The differentiating factor between hemp and marijuana is the cannabinoid THC. Cannabinoids are what make up marijuana, and there's hundreds of them. The interesting fact is, though, our brain naturally has cannabinoids developing in our brain. The problem becomes when they are smoked or ingested in a fetal state, they interrupt the natural cannabinoids. There has been very little research done on fetal development, mainly because it would be unethical. However, research has been extensively done on rats. In the rat research, it has been proven to cause long-term or possibly permanent effects on the chemicals in the brain. The cannabinoids work by controlling certain neurotransmitters such as serotonin, which helps with mood, dopamine, and norepinephrine, which helps with attention and focus. So when you interrupt these, you can just imagine the side effects that are going to happen to that growing brain. MRIs have been done on rats and shown high levels of cannabinoids in different parts of the brain. One part is the cortex that works with processing and thinking, the hippocampus, which works with long-term memory. So whether ingested or inhaled, research has shown that exogenous cannabinoids can induce multifunctional changes in the adult brain. The earlier exposure to these cannabinoids, the greater the long-term effect. So in adolescence, the brain is still building and developing new connections. They have seen an increase in adolescence, the anxiety, aggression, hyperactivity, and a decrease in short-term memory. There was also, in adolescence, in these research, an increase in depression, delinquency, and antisocial behavior. Longer-lasting effects include impaired learning and coordination, sleeping problems, and repeated use showed an increase in schizophrenia, other drug and alcohol abuse, memory issues, and the potentials for addiction. So as adults, the effects are similar to adolescence. However, our brains have already developed and grown. So the effects of marijuana and CBD are usually short-term. With all the negatives with marijuana and the developing brain, they have seen some positives in the endocannabinoids, such as pain management. It assists with the symptoms of PTSD. It helps control seizure activity, and it can help in chronic conditions such as cancer, assisting with nausea and anorexia. So even though marijuana is a natural plant, it naturally occurs in the brain, it does not prove positive in a developing brain. So with the legalization of marijuana and the new rise of hemp products such as CBD, everyone needs to be informed on the short-term and long-term effects, especially in that developing brain. Thank you. Thank you for